Russell, are you happy for us to start?
Yep. Just to clarify for everybody, the meeting is being recorded so that we can publish it on the CCG website.
Okay. Welcome everyone to NHS Buckinghamshire CCG's 2019-20 annual general meeting. And first of all, I am sorry that we've not been able to hold this meeting in public, but as everyone will know, this has COVID-19 has affected everyone's working lives, and we're no exception. As we work through the agenda, may I please ask, first of all, for people to be on mute if possible, just so we don't get any background noise, and to hold any questions until the end, when there will be an opportunity to go through the agenda and ask questions. You can post them on the chat box, and Russell will be collating those and we can work through them at the end. It'll just mean that we can go through the presentations rather more seamlessly, and it will help with time management. Russell, do we have any apologies?
Yes, we do. From governing body members, we have apologies from Crystal Oldman, who's the Chief Executive of the Queen's Nursing Institute and is our registered nurse on the governing body and a lay member, and from Dr. Karen West, who most people will know is our Clinical Director for Quality and Integration and also our Caldercook Guardian. Thank you.
And in terms of minutes of our last AGM, it was a joint AGM held with Buckinghamshire Healthcare Trust, and details, indeed a video of that meeting, are available on our CCG website. It is our intention to produce minutes of this meeting, which Russell will make available following the meeting. Are there any declarations of interest pertinent to the AGM agenda?
Just to clarify, I don't think there are. There's no formal decisions to be made, and approval of the annual report and accounts, as is elsewhere on the agenda, has already been through the approval process via the audit committee back in June under delegated authority from the governing body.
Thank you. I'd now like to just spend a few minutes with the chair's address, and the biggest challenge doing this year's address has been fitting it all into a timely fashion, because it's been an extremely eventful 12 months. I'll start more generally. Our commissioning approach since our last AGM, and indeed over a number of years, has been entirely consistent with the ambitions laid out in the NHS long-term plan. We continue to strive to develop stronger community-based services, informed by a population health management approach, tailored to the specific needs of our local population and communities. We continue to work closely with our 12 primary care networks, who are working with local health and care partners to develop tailored services with their local populations. We've paid particular attention to our care home residents and are strengthening both the breadth and depth of services available to support patients who may be frail, may be elderly, may have significant physical or mental health long-term conditions, or who may be younger with significant learning disabilities. We have maintained our focus on the wider social determinants of good health, working with our local communities, public health and Buckinghamshire Council to empower more of our local population to live a greater proportion of their lives in good health. The events of recent months has strengthened the close working with our partner organisations in health and social care in the Buckinghamshire Integrated Care Partnership. For those that don't know, that's shortened to the ICP, if you hear that term used later on in the AGM. I'm really pleased to say that Buckinghamshire as a system has risen to the considerable challenges thrown up by the COVID-19 pandemic. As in previous years, there is a gap between our NHS budget allocation and the demand for healthcare in the county, but we will talk about that later in the AGM. We continue to be an integral part of the Buckinghamshire, Oxfordshire and Berkshire West integrated care system, and that's known as the BOB ICS. The ICS seeks to ensure that our population can benefit from the learning together and working at scale with our fellow CCGs and our system partners. Our ambitions, both as an ICP and an ICS, have been considerably strengthened by the appointment of our new accountable officer, Dr. James Kent. James has taken on the role of Chief Executive of the Bob ICS, as well as the accountable officer role in each of the 3 CCGs. He is leading the work towards the better integration of services and closer and more strategic working between the health and social care organisations across the Bob footprint. I'd like to end the Chair's address by paying tribute to some of the groups and people who have been instrumental in serving our population during the year, especially during the COVID-19 pandemic. Of course, this includes the frontline health and social care workers, as well as key workers from the wider support and supply services who have continued to serve all our communities. I'd like to thank the population of Buckinghamshire for their adherence to the government advice regarding COVID-19 and the thousands of acts of neighbourliness and kindness, both by individuals and voluntary groups throughout the county, which has helped our most isolated and vulnerable residents. It remains a privilege to lead such a highly skilled and dedicated CCG team who have risen to the challenge presented by COVID-19 and remain focused on ensuring that our NHS resources are utilised for maximum benefit to our local population. And I'd also like to thank the governing body and our 48 GP member practices for their continued support. Thank you. I'd now like to introduce Dr. Reshmi Sawhney, who's going to do a presentation on the work that we've been doing to try and reduce the health inequalities for our population in Buckinghamshire.
Thank you, Raj. So I did a presentation in November to the governing body, and we talked about the health inequalities that exist and the public health figures that had been presented to us. However, since then, COVID-19 hit us, and some of those health inequalities have widened. And so I've concentrated on health inequalities in COVID-19 for today. So what was our immediate response? As a CCG, we developed what was called the COVID-19 huddle. The organisations came together, and some of us were meeting every day, really, just to look at the situation on the ground and how could we address it. New issues that were turning up every day, whether that was to do with PPE, testing, ensuring that frontline healthcare staff was safe, and also the care of our vulnerable population, including those in care homes. A regular communication was set up to primary care, which again was tailored to the needs. So it was a daily communication initially, and later on changed to, 3 times a week, and now it's a weekly one. And again, that will be monitored. Training and support was offered to primary care. So this was around infection control and, what are the things they could do to support their population in the best way possible. And we were constantly listening to feedback from our member practices and our patients and responding to it as the situation changed day by day. Next slide, please. Ramadan fell at that initial phase, and I'm very pleased to say that the community came together with the CCG and our other partners, and very positive Ramadan messages were developed in collaboration with the voluntary sector, as well as with some of our Muslim GPs to help support the community through the fasting month and through Eid. We also joined the care home steering group, which was led by the council, and again looked at the wider issues that were affecting care homes so that we could address them or come up with steps to address them fairly quickly. And some of the support that came about was training of care home staff in infection control, use of PPE, immediate care, which was set up and out to all the care homes now, and that offers video consultations directly to care home staff. So if they have any questions or concerns, they can go straight there. Restore 2, which is a pilot being undertaken at the moment in a few care homes to identify people who are deteriorating. A visiting service was set up for care home patients, again with collaboration with our ICP integrated care partners. So quite a lot of activity going on. Moving forward.
Rashmi, can I just pause there for a minute and ask all attendees, if you're not speaking, please could you put your speakers on mute, and then we won't get the feedback that we're hearing as Rashmi's presenting. Thank you.
Thank you, Raj. In terms of primary care workforce safety, now this is really important because all the data that was coming out did point out the risks, especially to the BAME community, and there were a lot of fatalities as well as, illnesses amongst the BAME community and the healthcare staff. So primary care was supported for conversion to electronic prescribing, and I think almost overnight, within a few days, a majority of the prescriptions were changed to electronic. Other IT measures were telephone and video consultations were enabled via AccuRx, and laptops were provided for clinicians who are shielding to ensure their safety, but to ensure also that care to our patients is not compromised. Next slide, please. Hot hubs have been developed, and these have been developed at Wickham as well as Aylesbury sites. So these were people who were suspected of having COVID with high temperatures and other symptoms to be seen in a safe place, which was the hot hub. Similarly, a visiting service was set up as well. So there was one separate service for the care homes, but another visiting service set up for people with suspected COVID in their own home. And this was specifically for the frail elderly who were living in their own homes or supported living. Staff risk assessment templates were developed. So in line with national guidance, risk assessment was carried out. We looked at validated templates and shared them with our PCN and our primary care colleagues. We also asked for feedback for if any further training was required to support member clinicians and non-clinicians within the practices with the impact of COVID, especially any psychological impact from that. We developed a Bucks PPE emergency supplies warehouse, and people will be aware that there had been an issue with PPE supplies, and the emergency supplies warehouse was fantastic in that they were liaising with primary care and literally physically delivering those to practices to ensure that every practice and the care homes were covered. Moving on. So the key issues that have come up that have contributed to the widening of the inequalities gap are economic well-being, with lots of people being furloughed and unsure of what's happening with their jobs, household food insecurity, and that's a big issue. Domestic abuse, which may have been hidden in the past 3 months because very few people were coming for face-to-face consultations, and change in lifestyle behaviours. So if people were indoors all the time, was this contributing to weight gain? And then address issues with blood pressure, weight gain, diabetes, and other issues. So those were the big issues that we need to focus on as a system rather than separately as health and social care. Personal well-being and impact on mental health, and we are seeing that quite a lot. So although initially the calls to mental health teams were few and far between, as things have started to improve and people are coming out, we are seeing that anxiety, depression has gone up, and also presentations with major mental illnesses is high as well. There's been issues related to delay in accessing care. And so it could be that people were scared to contact their GP initially with worrying about catching COVID, so did not present, or they had ongoing conditions but didn't present, and worsening of existing conditions could potentially have occurred. Impact on care home residents and staff is widely known. Initially, care home staff were did not have access to PPE, which has been corrected, and there were training issues with infection control, and that then had an impact on them as well as the quality of care to the residents initially. However, all that has been taken into account and lots of steps are in place to help support the care homes. Moving on. So a clinical harms group was set up because we do need to quantify and see what is happening, what issues are happening, and how can we move forward. And this group was, again, an ICP group, so from all different organizations that reviewed each specific area and came up with some key recommendations. And number one amongst them was cancer prevention and early diagnosis. And in fact, 2 areas of focus have been identified, Aylesbury and Wickham, because in terms of cancer prevention and screening, it is known that the populations in deprived areas are the ones that don't access the screening as much, so that they are targeted, and also people from BAME backgrounds and learning disability. And a team has been working on how to focus on those particular groups and those areas to encourage people to come for screening. Health checks, again, all the data has shown that underlying conditions like high blood pressure, diabetes do contribute to worse outcomes with COVID, and public health are now undertaking some additional health checks to the ones that they've already commissioned. And again, they're trying to target people in areas of deprivation. Vulnerable people, dementia, again, deaths with dementia have been higher than the general population, and we do need to A, identify people with dementia, and B, ensure that they're getting the maximum support and healthcare that is required for their physical and mental health. Second surge plans are really important, and I'm not going to go into details because another team is going to be talking about that, but second surge plans are really important to ensure that there is increased uptake of flu vaccination, there is increased support for care homes, and also that there is proactive monitoring of our population to ensure that the outcomes are improved.
Rashmi, I'm just going to try and draw things to a close now, just so we've got time for the other items.
I've just got one last slide.
Okay.
And so just to finish, there is lots of restoration and recovery work going on at different levels. Primary care, we've had time for care workshops, shared our learning and applying that. The clinical harms group I've mentioned, work with BAME communities and the inequalities team, and also the PCNs are engaged with the NHS England population health management workshops, again looking at data sets to see what they should be concentrating on in their areas and how to improve health and reduce the inequalities gap. Thank you.
Thank you, Rashmi. And I just want to acknowledge the amount, the size of the challenge and the amount of work that has been done in an extremely short period of time, quite effectively, which I think really has built a solid foundation for some of our partnership working and working with our local communities moving forward. So I'd just like to thank Rashmi and the team for all the work they've done on that.
Thank you.
Just before I introduce Gary Hennig to the next item, I just want to acknowledge that this will be Gary's last AGM for the CCG before he moves on to a new role. And I want to thank Gary for all the work he's done for the CCG over the years, but more specifically, Gary led the work on sourcing and distributing personal protective equipment for frontline workers through COVID, and I think he did that job extremely well. So just on behalf of the CCG and the population of Buckinghamshire, I just want to thank Gary for that work, and I'd like to hand over for him to present our annual report and accounts. Gary.
Thank you, Chair. So good morning, everybody. So as Raj has outlined, I'm here to provide an overview of the annual report and accounts for Buckinghamshire Clinical Commissioning Group for the year ending 31st of March 2020. So just in terms of some context first, so the accounts were approved by the CCG's audit committee, and that was done on the 16th of June. And then we did publish the accounts on the CCG website on the 8th of July. And I'm pleased to say that all areas of the accounts in the year that we're looking at were unqualified. So if we could move on to the next slide, please. So just to highlight some key areas really. So we ended the year with a surplus of £63,000. And what that means, so what does a surplus mean? Well, a surplus means we effectively spent less than our income. Now, as it says on the slide, our income was 755 million, and income is often described as our allocation. During the financial year, the CCG's position was supported by what is known as CSF, which is Commissioner Sustainability Funding. So that helped us to get to that £63,000 surplus. That really concludes my presentation. And just to say really that the annual reports and accounts are on the website for those who wish to read the detail. But thank you very much.
Thank you, Gary, and there will be an opportunity to ask any questions at the end of this meeting. I'd now like to introduce Dr. James Kent, who is going to just talk us through the forward look for 2021.
Thank you, Raj, and good morning, everyone. So what I'd like to do is just sort of outline our sort of key priorities over the next, from now to the end of this financial year, and then just pick out one or two details in each of those priorities that you can see in the report from myself and from Robert that's in the papers. So from both a system perspective, there are sort of 5 key priorities that we are sort of working through at the moment and will be doing through to the end of the year. The first is obviously our response to COVID-19, and while at the moment we have very low levels of infection across the county, there are clearly pockets that we are becoming worried about, and as you had seen on the news, obviously a concern that there are rising rates of infection, not only in Buckinghamshire but across the county, and we have quite detailed plans and multi-agency working to try and detect and react to those outbreaks as and when they occur. The second priority is obviously to try and set back up the core services and the non-COVID services that patients expect from the NHS, and that's within primary care, it's within secondary care with electives, and it's obviously on cancer services and diagnostic services as well. And on this, I just wanted to outline that obviously, in a way, the reason setting up is proving challenging is we have both a backlog to manage, because many of these services were stood down for many weeks through the first COVID spike. So we have a backlog to clear, but we also have in many places more limited capacity because of the changes to ways of working that COVID and the use of PPE, the need to refresh the air in rooms and other social distancing reduce the capacity that we have in some places and some services to be able to do that. So there is an ongoing challenge to, I think, less around standing services up, but more importantly to make sure that we can stand them up to the levels of as close to pre-COVID levels as we can. And as we work through with our provider colleagues, I think we are not quite there yet, but we would expect by the time we reach the end of September to have plans in place that are compliant with the expectations that NHS England have on us in terms of the standing back up of those services. The third thing is obviously the preparation for winter. And at this point in the cycle, we would always be focused on building resilience ready for winter, particularly in the urgent care pathway. and there is ongoing work across the ICP to both put that resilience in place, as well as to put in place a national programme that is around using 111 first. That's it's a pilot that is being rapidly rolled out, and Buckinghamshire is in the lead in terms of putting that in place. But also linked to the preparation for winter is obviously making sure that we have a successful flu vaccination programme. And this year, that programme is much broader than it has ever been for obvious reasons. And there, again, is work and quite detailed plans being put in place in order to make sure that not only we have the right supply levels of flu vaccinations, but also the mechanism to vaccinate, as I say, a broader range of cohorts than we would normally focus in on. The fourth is around inequalities, and COVID, as we've just heard, there is clearly a focus on inequalities. I think the spotlight on this space is of greater intensity than it has been for a while, because it's been brought into greater intensity through COVID. And actually, I think that is providing the energy to get more action in this space, as we can more clearly see need. And you've already heard from Rashmi of some of the work that we've been doing there. And then finally, within the workforce, it is obviously quite a grueling time for our workforce. We have clearly different ways of working through COVID, and particularly for the frontline staff, different degrees of risk than there's been. And there's been such a huge concerted effort over the first spike, and obviously many of us look at the data and can see the risk that there's a second spike. So caring for the workforce, well-being for the workforce is something we want to dial up. But in addition, we are working to ensure there is greater equality for our BAME colleagues across the workforce. Again, a deep-rooted issue that we need to address, but is one that has been brought into sharper focus and spotlight through COVID, and that's again one of the priorities for the system as we move forward through this year. So I will pause there, and obviously happy to take questions towards the end. The final thing I just wanted to do is to reinforce the warm support and thanks that Raj gave to Gary, and thank him for all the work that he has done. And from a personal perspective, when I first arrived in this role in the middle of May, I think Gary's name was mentioned more than any other in the first 2 or 3 weeks, with people saying, if you can get more people like Gary doing things like PPE, you'll be highly successful. So I just wanted to again reinforce the thanks to Gary for all the hard work that he's done, not just as CFO, but also supporting actually not just Buckinghamshire, but the whole of the integrated care system when it came to such a critical topic as PPE. Thank you, Gary.
Thank you.
And I think that's a view that's widely shared amongst all the staff that have worked with you over the years, Gary. So please take our warm wishes and best wishes with you.
Thank you very much, Raj. It's very kind.
Thank you, James. There's now an opportunity for any members of the audience to ask any questions. And so first of all, I'll invite any questions regarding the Chair's address. And if you have got the hand function on your Teams app, then please use it. Any questions on the tackling health inequalities?
There is a hand up from Juliet, Raj.
Okay, Juliet.
Yeah, thank you. Yeah, the only other thing I just wanted to highlight it was also obviously the fact that with schools having been sort of partially closed, obviously for so many months over.
Sorry, Juliet. Would you like to introduce yourself in case people don't know who you are?
Yeah, no, that's fine. Sorry, I'm Dr. Juliet Sutton. I'm the Clinical Director for Children's Services at Bucks CCG. hence my always going on about children. And it's just, as I say, just the huge inequalities that we have seen that have built up even further, obviously, over the last few months when schools have been shut, and it seems to have just widened the gap between those in the lower socioeconomic groups and those who have and those who have not. And I think we've seen even greater divides in our children, particularly with the schooling issue. And I just think we need to be really mindful of this as we go forward, in particularly into the winter period. Thank you.
Thank you, Juliet. Any questions regarding the annual report and accounts? And any questions on James's piece about the forward look and the challenges ahead? In that case, could I thank everyone for logging into this. Hopefully in 12 months' time, we'll be in a much more comfortable space as a country and we'll be able to meet in person and have a rather more in-depth AGM. But I'd just like to thank everyone for taking the time to join us today. Thank you.